we're really grateful that Meghan helped us understand a little bit about the 872 commission. NAMI's been really involved with advocacy in Montana for years, but this is kind of a different animal, and we do really need someone to help us understand where things are, what it looks like. Meghan Reacher's last year was Senator S. So we're really delighted to have another presentation from her about where things are at and how we can help for the next part. So thank you.
Thank you, Matt. Yeah, my name is Megan Peel. I am the acting administrator for the Behavioral Health and Developmental Disabilities Division. I've been with the department for about 13 years now and have worked in the behavioral health field for 7, I believe. I worked in the children's mental health system for a long time and recently have taken on new roles. And it's hard to believe that it's been a year since the last NAMI conference, and when we were just introducing the work of the House Bill 872 commission, which is a commission for behavioral health systems for future generations. And what that bill did, it was passed in the 2023 legislature, and it invested $300 million of the budget surplus that the state had in making investments into our behavioral health and developmental disability systems. So over the last year, since I was last at the NAMI conference, the commission members, which consist of 6 legislators and then 3 governor-appointed commissioners, have traveled across the state. I believe we've had 13 community meetings in locations from Billings to Kalispell to Havre, and we focused on different priority areas that were identified by the commission. And so I'm just going to highlight what their 7 core priorities were that were really our North Star that guided the work. And they were a comprehensive statewide crisis system, clinically appropriate state-run healthcare settings, and a functional commitment system, increasing the capacity of the adult behavioral health system, increasing the capacity of the children's mental health system, increasing the capacity of the developmental disabilities system, and then looking at how we can help co-occurring populations in those areas. And then finally, and maybe most importantly for the commission, was family and caretaker supports. And so throughout our commission meetings across the state, we made sure to invite those who had lived experience or family members of those with lived experience, so that we can really use their voice and experiences to inform our recommendation. So about almost a month ago now, we submitted our final report on what we recommend the investments look like. We submitted it to the governor, and this is a copy of it, and we have it electronically posted, which Matt and Colleen can share with the NAMI email group. But this is a 75-page document that goes into a lot of detail about some of the big gaps in our system and how we want to invest in fixing those gaps. We found that there were a couple key themes that we identified. One was case management and care coordination. And we really need to make investments to improve and strengthen and rebuild our case management systems across the state, because it's such a critical component for individuals and families to access care and navigate our somewhat complicated healthcare systems. The second key theme was just our continuum of care and where we were lacking different services. And one of those was the crisis system. Like, we have identified many areas where we need to invest in our crisis system, including somewhere to go if you're in a crisis, or mobile crisis response teams to come to you. And then finally, we recognize that workforce is a very critical piece of our behavioral healthcare system, and that we need to invest in our workforce by making people excited to come work in the field of behavioral health, providing tuition reimbursements, and also making investments on proper training for people so that they can really feel competent and confident in their jobs and provide high quality services. We don't have a lot of time, and I do want to give a bit of time for questions. So I just want to, I'm going to highlight throughout the process, we had kind of two tracks of how we were making investments. And the first track was what we call near-term initiatives. So these were things that we identified that we could take action on pretty quickly and didn't require ongoing funding. And so we had 11 of those near-term initiatives, and I'll give a couple of examples. One of those was to make investments in court-ordered evaluations to happen in the community to try to reduce the wait list for those court-ordered evaluations to happen at the state hospital. And so we have worked to create a network of qualified professionals that can do those court-ordered evaluations in the community so that individuals more quickly can access services and supports that they need, and reduce unfortunate and horrible wait times in jails. Another big one that we did was investments in residential capacity across the children's mental health system, the adult behavioral system, and the developmental disability system. And so the commission and governor approved just under $16 million to be given out to residential providers to reopen beds that have closed in the past couple of years, like through COVID and other staffing issues, and then also open new beds if needed. And so we're anticipating across those populations over 220 beds to be reopened in the next 18 months, which we really hope will help people be able to access services that they need when they require a residential level of care. So we had 11 of those near-term initiatives. And then the other track was just ongoing recommendations. So we have 22 recommendations in our report that are larger, longer-term recommendations to strengthen our behavioral health developmental disability system. One of those is enhancing our targeted case management program. So we're looking at, how do we reimburse for case management? Are there ways that we can incentivize the outcomes that we want? How do we better serve individuals in Montana that would benefit from case management? We're also looking at one that's also related to case management and care coordination, which is a very high intensity, time limited care coordination or case management for individuals discharging from the state hospital. And it's called critical time intervention. And what it does is brings a very trained, specific staff member to an individual who will be discharging from the state hospital to help them find housing and services in their community, and really support an individual so that they can be successful at discharge and hopefully reduce readmissions. There are several recommendations that are focused on our crisis system, including increasing our mobile crisis response teams, which are teams of professionals that are trained in crisis intervention that receive a call and are dispatched out to provide trauma-informed, clinically appropriate care to an individual in crisis, and hopefully reduce the criminalization of mental health symptoms. And then there also is a recommendation around expanding, crisis receiving and stabilization services. So if an individual can't be helped by the mobile crisis team and maybe needs a bit more support, they have somewhere safe to go to receive care. There are also recommendations around the peer support program that we have been paying for with Medicaid. And it sounds like that's something that's really interesting and valued by this group. And so we're looking at ways that we can expand who can receive peer support so that it's not, it can be used more as a preventive measure for individuals that are struggling with their behavioral health. We have one recommendation around launching a media campaign to reduce stigma and hopefully educate people on behavioral health and how it really impacts every single person in the state of Montana, whether it's themselves or a loved one or a neighbor or coworker. We have a recommendation around reducing barriers to care related to transportation. We heard over and over again that transportation to services, transportation is just hard for some people, and we really need to help support individuals in getting to care. And what we currently have covered in our Medicaid system is not cutting it, and we need to increase that. We also are looking to allow family peer support to be a covered Medicaid service, which is very similar to the peer support we currently have for individuals with substance use disorders or mental health diagnoses. But this is would be a Medicaid reimbursable service for where the peer is a family member who had, a child, a loved one that walked through the journey of behavioral health needs to walk hand in hand with another family and say, I've been there. I know how hard this is. These are the things that I did. There's hope on the other side. So very similar, but generally for families who have children that have behavioral health needs. We're also looking to reimburse based on acuity for some of our residential programs. So what that means is right now we have the same Medicaid payment rates for all residential services, regardless of what an individual may need. And we're looking at, some people need a little bit more supports to be stable, and so that provider might need to be paid a little bit more if an individual has some complex needs. And then one big one that I am very passionate about with my previous work in the Children's Mental Health Bureau is investing in school-based services and just looking at ways that we can work with schools, with teachers, with counselors to do some prevention, do more prevention work in schools and get services into schools so that we can try to give kids and families the skills and the knowledge that they need to be successful. So there is a big emphasis on that. And there are a few other recommendations that are very specific to the developmental disabilities division. And then around workforce, we're looking at recommending tuition reimbursement programs for individuals that are joining the behavioral health workforce and really targeting those that have been underrepresented in other tuition reimbursement programs that currently exist. So we're really looking at paying for bachelor's level social workers or other degrees. We have a whole list of relevant degrees, but we're not just going to be paying for the highest educated people like doctors or physicians that often are able to receive some level if they serve in certain areas across the state, but just expansion of that. And then looking at, I mentioned this earlier, but just expanding the training content that is available to provider agencies and the workforce so that they have the tools they need to do their job well, and that they feel confident and competent in doing their work, so that we hopefully will reduce turnover in that work. So that was a tremendous amount of information in about 15 minutes, but it's what I've been working on for the last 18 months, and it's this product is probably one of the things I'm most proud about in my career of doing. And I will add one last thing, and then I will hopefully have time for a couple of quick questions before we start the really important work of the focus groups. But going forward, what we need is, we still need some legislative action to make these recommendations happen. So, NAMI as an advocacy group has been present at all of our meetings, and hopefully will continue to support our work by being a voice for individuals with mental health experiences, and hopefully we can get continued support to fund some of these, because some of these will require additional funding in future years, that has to be approved by our legislative body. So we may have time for just a couple of questions.
Sure.
Hello, so you mentioned that there are barriers to care, specifically with transportation, and I noticed that was a huge theme throughout the entire day, as transportation and access to people who need mental health services. So what is like currently covered, and what are you guys kind of looking to be included in the future? Because I think you touched on
Currently covered, I might have to follow up with this so I don't get it wrong, but right now there are some ways that people can be reimbursed through Medicaid for coverage, but it is pretty low reimbursement, and it's not the easiest system to manage. So what we're kind of looking at is if we can do some sort of prepaid program. There are various solutions that other states have used, where there's like a vendor that can issue reimbursement beforehand to prevent transportation, but some of that will still need to be ironed out on exactly what the details are. And as we do operationalize and implement, we'll definitely look for feedback from users and providers.
Hi, I'm a peer support in Helena, and one thing that I've noticed with some of my coworkers, myself, and other people in the community that work in this, is that with all the recommendations that you listed, I did not hear increased wages. So for an employee, I think as a peer support starting off at Mini Rivers where I work, they start off at $15 an hour. Starting wage at McDonald's is $17 an hour. We are not able to afford health insurance. We're not able to afford childcare. We're not able to afford the things that enable us to like work effectively. And a lot of times we're losing the very services in which we're working so hard to get our clients, like Medicaid and food stamps, which make us relapse. I mean, we're peer supports for a reason, right? We have mental health and coexisting addiction problems. So when we lose Medicaid, we can no longer get the services that we're giving our clients. So I think that is a glaring hole that needs to be filled immediately.
Yeah, thank you. I will say that one of the reasons that rates and Medicaid reimbursement is not addressed in this report is because at the same time that we were passing this legislation, the legislature and the governor also approved a really historic investment in Medicaid rates. And so we did a rate study with an independent provider and looked at the cost of these services, and the legislature approved $339 million to go towards increasing Medicaid rates. And so and they were very specific to behavioral health, developmental disabilities, and senior and long-term care. services, and so we did in the last 2 years, increase our rates significantly. And so we don't really have a control over what providers individually pay, but we did make a big investment in increasing what we pay to providers. Which I'm sorry, I know that doesn't totally address the issue that you're seeing, but we are working.
It seems that with this administration, adopting a crisis with child. We're seeing a crisis with healthcare, we're seeing a mental health crisis, we're seeing all of these crises. And we're not getting paid enough to deal with. So something has to give.
And so we will go in depth in the focus groups. This is exactly the kind of thing that we want people to do. Okay, and we have one more question and then we'll.
Hi, Meghan. I'm just wondering if this is Medicaid only based initiatives? Or is it Medicare? Is it, if you, okay,
Do you want to ask me?
no, okay.
Many of the recommendations are related to Medicaid services, but many of them will cover all individuals. For example, the crisis system, like we have control over Medicaid reimbursement and supplemental funding that we give, but the crisis system serves all people. Similar to some of the discharge, like the discharge recommendation from the state hospital would serve all. So there are certain areas that are very specific to Medicaid reimbursement, but we really did try to look at things as a whole. But it does not address like private insurance programs because we just don't have any control over that piece.
Thank you.
So thank you so much, Megan, and this is an ongoing process. And we will be there to support and let people know what to do at the legislature. But this is part of the goal of figuring out what we want next and continuing the conversation, because as I read the 872, it's like a 20-year effort. And we will all stay involved with that for 20 years and be part of that push, be part of that process. Because as soon as we don't fight for something like this, it goes all the way. So they can build it. So we've got to be there to sustain it. But we had Megan sign these short as a way to make sure that she could stay here for the whole focus groups and be able to participate. So we're really grateful for leadership and her work and being able to just be cool with us. So thank you, Megan.